Institute of Higher Medical Sciences, Whitefield, will guide us through SAI's mission's commitment to tertiary neurological care. I invite Dr. Takar to speak on the topic Tertiary Neurocare, Navigating Neural Space.
Sri Sai Ram. I am honored to share an overview of the journey on contributions of the Department of Neurosurgery at the Super Specialty Hospital in Whitefield over the last 2 decades. The department has grown steadily in scale and scope of services over the years. Key clinical milestones include a circulatory arrest for complex aneurysms way back in 2002, skull-base endoscopy in 2014, high-flow bypass in 2019, and a structured stroke service in 2022. These advances have allowed us to treat more patients with conditions earlier considered difficult to manage. Over 34,000 surgeries have been performed so far. Each day involves 6 to 8 procedures and almost around 50 to 70 outpatient visits delivered by a patient-centered team working with utmost dedication. The department manages a wide spectrum of cases: brain tumors, arteriovenous malformations, aneurysms, spine disorders, and congenital anomalies. Both adults and children are cared for through well-defined treatment protocols grounded in current best practices. As seen from this chart, the cranial tumor surgeries account for a larger share at around 40%, followed by spinal degenerative cases. The department has 4 fully equipped operation theaters and a 20-bedded ICU. Amongst the high-end equipment are 4 operating microscopes, including 2 recently acquired Leica OHX units, one with tumor fluorescence and the other with vascular fluorescence. Amongst our high-end infrastructure is the Medtronic neuronavigation system, a GPS-like tool for the brain. First installed in 2001 and was amongst the earliest in Southeast Asia. It has since been regularly upgraded and continues to support complex surgeries with enhanced precision. Regularly updated, it remains an essential tool in planning and performing complex neurosurgical procedures with precision. Intraoperative neurophysiological monitoring, neuro and skull-base endoscopy, and a Siemens biplane angio suite are also part of our infrastructure. Our department regularly performs awake craniotomies, endoscopic skull-base resections, minimally invasive spine procedures, and complex vascular procedures. With the inspiration and support of our director, Dr. Sundaresh, a dedicated neuro rehabilitation is being established at a hospital. It will be equipped with advanced systems such as virtual rehab devices, robotic-assisted cycles, limb trainers, and reflex-based training tools. The center will primarily serve outpatients recovering from stroke, spinal cord tumors, injuries, and brain tumors. To make it a complete package, the center will also be offering neuropsychological support, which is a vital component of any neuro rehabilitation service. We are grateful to Dr. Jayashankar Reddy, an ardent devotee of Baba and Dean of the School of Social Sciences, Christ University, Bangalore, for his help with this project. Our department stands today on the foundation laid by Baba's vision and blessings, and the structure built by Professor A.S. Hegde, who translated that vision into clinical, academic, and ethical practice. With over 17,000 surgeries over his career and a generation of neurosurgeons trained under him, his influence continues to shape our work today. The department continues to follow the vision set by Baba and Professor Hegde, focusing on ethical, academic, and compassionate neurosurgical care. Successive heads of department and consultants trained at premier institutions across India have brought together diverse perspectives. We are deeply grateful to our visiting consultants and mentors whose spirit of service have greatly supported the department's growth. I would especially like to acknowledge Dr. Anil Nanda, Chair of Neurosurgery at Rutgers, New Jersey Medical School, USA, who has been particularly generous in strengthening the department through academic mentorship and assistance in sourcing equipment and other resources. We equally acknowledge the continued support of other senior faculty from India and abroad who have enriched our clinical teaching and academic programs. I would now like to share a few representative cases that highlight how timely interventions and multidisciplinary care in our patients lead to excellent outcomes. A 4-year-old child with a cyanotic heart disease presented with a large brain abscess. Emergency neurosurgical aspiration was performed. He later returned for successful corrective heart surgery, addressing the root cause of his brain abscess. A strong example of staged and coordinated multidisciplinary care. A 46-year-old farmer, the only breadwinner in his family, was brought unconscious with a ruptured aneurysm. He underwent an emergency surgical clipping and then over a month required close to 10 intraarterial nimodipine infusions in the cath lab to manage severe vasospasm that had led to leg weakness. He made a full recovery and was back to work by 3 months. This photo with his family is a moving reminder of how timely intervention and coordinated care can enhance outcomes. A 22-year-old man presented with progressive quadriparesis, weakness in all the 4 limbs due to a tumor spanning almost the entire length of his spinal cord. He underwent a single-stage resection of the tumor over 10 hours. Post-operatively, he required prolonged ventilation for over 2 months, followed by extensive rehabilitation. He eventually regained the ability to walk independently after 6 months. A remarkable example of restorative care, made possible by surgical and sustained rehabilitative effort. In addition to stroke management, the department also offers endovascular interventions for conditions like aneurysms, arteriovenous malformations, both brain and spine. Such techniques offer safe alternatives in select cases with quicker recovery and reduced hospital stay. Coming to academics, our department runs a robust DNB residency, admitting 1 candidate every year into a structured 6-year course. To date, 14 residents have graduated and 5 are currently in training. The program emphasizes clinical and academic excellence, and our alumni have consistently excelled at leading centers both India and abroad. The department hosts regular CMEs and multidisciplinary meetings. A recent stroke symposium led to the setting up of a stroke unit in the hospital, an important step forward in enhancing time-sensitive care and multidisciplinary coordination. The department has received multiple awards, including a Center of Excellence status for glioma research from the Government of India. The department has received multiple awards, including the Best Paper and the Young Neurosurgeon Awards at various national and international forums. With over 200 publications in index journals, the department has consistently topped DNB centers in India in publication metrics and academic output. The department collaborated with premier national institutions such as the Indian Institute of Science and the CSIR on multiple research projects. Our department published 2 significant articles in reputed international journals, showcasing the Sai healthcare model and its distinctive principles in action. Both articles were well received, cited multiple times, and have drawn global attention to Baba's approach to value-based care. 2 of our publications, including one in the new journal New England Journal of Medicine received international attention and were featured in several prominent media outlets, such as the Daily Mail, India Today, and Times Now. This is our team, faculty, residents, nurses, and support staff who work together seamlessly. Every surgical outcome is the result of this committed and well-coordinated collective effort. It has indeed been a blessing to serve in a department shaped by Baba's values of compassion, service, and excellence. We look forward to growing together through shared learning and continued collaboration. Thank you, Sairam.
The talk was ended with surgical precision. Uh, Thank you, Dr. Takar, for showcasing the excellent clinical, academic, and research work being done by the department over the years, and for taking us through the subtle intricacies of neural healing with grace and depth. The next